I start by reviewing the patients I have for the day and what condition they were in when I last saw them, so I know exactly what procedures I'm going to have to run through. I then ask my patient how they have been feeling and if any new symptoms have come up. I make sure to keep all data written down on the patient in order to keep a solid profile on the patient's medical history. The first physical exam I do is taking the patient's pulse in order to ensure the health and well-being of the patient. I repeatedly write down all the data that is being collected in order to keep track of the physical exams being taken. The next physical exam I do is taking blood pressure of the patient. This is to check the risk of health problems in the future that the patient may face. Another small exam I perform is testing the reflex of the knee in order to make sure there is no damage done to the central nervous system. Lastly, I check the patient's mouth in order to see if infections, stress, or medication issues have gotten into their mouth and left marks. I also review what exactly I found during the physical examinations and what medicine I will be prescribing them. Then I make a call to the pharmacy in order to pass the medication through insurance and find out when it will be ready for the patient. A major part of being a physician's assistant is keeping strong communication between the doctor and I. All the information I attain throughout the day is shared with the doctor, and all the medications are ran by them in order to review if the best options were given.